Hi Dad, if someone walks into your clinic with chest pain, what actually goes through your head?
Yes, Lara. Well, I suppose people are coming to see me because they're worried that their chest pain's due to their heart. And I need to work out relatively quickly, is this something that's an emergency? Or is this something that's been grumbling on for the last few weeks? Working that bit out quickly kind of defines the next 10 minutes of our consultation.
So what are you actually thinking when you first see them?
So here's the thing, Lara. Chest pain can come from lots of different places. It could be coming from the lungs, it could be coming from the stomach, could be anxiety, could be muscular. What I'm trying to hone on quickly, is it coming from the heart? Specifically, actually, is it coming from the arteries of the heart? Because that's what causes heart attacks. They want to know, the patient wants to know, well, am I about to have a heart attack or am I at risk of one? So I'm listening very carefully at how they describe the pain. Heart pain that comes from the arteries have a very particular feel to it. It's usually a pressure or tightness around the chest. It's worse when they're exerting themselves, like going up the stairs or rushing for the train or the bus, and it's often then relieved when they stop the exertion. In some occasions it can move to the arm or it can go up the neck.
And is chest pain always the heart?
No, honestly, most of the time it isn't. As I mentioned, it could be acid reflux, it could be a strained muscle, even anxiety can cause pain that feels really real. But the important part is that you can't assume it's not the heart. You have to prove it, and that's where my job is. And you have to get the right tests done to ensure that the heart is okay.
What tests do you actually run?
So we will start off with a basic ECG, looking at the rhythm of the heart, see if there are any subtle changes. On top of that, we can do some basic tests. An ultrasound of the heart is what we call an echocardiogram. We look at the structure of the heart, the function, the pumping function of the heart. As you know, the heart's a pump. But specifically for chest pain, and as I mentioned, we're worried about the arteries, probably the most important test in first line, apart from the ECG, is doing a CT scan. A CT scan, nowadays, we can look directly at the arteries of the heart, and I can see, are there any narrowings, blockages that could be of any concern.
So what should someone at home do if they get chest pains?
Well, as I describe it, if they have severe, crushing chest pain, they feel sweaty, nauseous or clammy, they should call 999 and should go to an emergency department. If it's a niggling pain that you're walking around and you're getting it on exertion, as I mentioned again, a tightness or heaviness, you should get that checked out. Either go to your general practitioner and make an urgent appointment or see someone like myself.